The mosquito-transmitted Zika virus has laboratories at Washington University School of Medicine hard at work. Frozen samples of the virus from Africa and the Americas are stored in a lab used to study the impact of Zika virus infection on the body. This is the mysterious Zika as seen through a microscope. In the School of Medicine's Infectious Disease Division, Michael Diamond's team first genetically altered mice, creating a mouse model for the Zika infection to occur. Then came a series of discoveries, seemingly at a rapid rate.
This is a virus that we didn't know anything about. So the landscape was empty. So there was a lot of room to move into different directions for studying it. Obviously, as you have a new worldwide epidemic, government saying, hey, we need to study this, let's divert some of our resources to do it, as well as an important public health measure.
The World Health Organization declared an international emergency. Zika is spreading rapidly through South America into the United States. Women who are pregnant or who will become pregnant and their unborn babies are the concern. The Zika virus can be passed to the fetus. Zika is crossing the placenta and attacking fetal nerve cells, causing microcephaly and other birth defects. Babies with the condition have unusually small heads and underdeveloped brains. The brain may stop growing. Brain damage can be severe, including fetal and infant deaths. The fact that Zika is getting past the placenta is alarming. As if that's not enough, Diamond is one of the researchers who helped establish Zika can be sexually transmitted. Soon after, Diamond and his fellow researchers made another alarming discovery. Zika not only attacks the fetus, it may prevent pregnancy. Diamond says in male mouse models, Zika is targeting the male reproductive system, reducing fertility.
Lower sperm levels, less motile sperm, and ultimately decreases in hormones that the testes are producing, and ultimately loss of fertility. Not complete loss of fertility, but reduced fertility in the mice.
Male mice were injected with Zika. After 1 week, the virus migrated to the testes. After 3 weeks, the testicles had shrunk to 1/10 their normal size, and the internal structure was destroyed.
Once they had significant damage, it doesn't repair.
This suggests the possibility of Zika causing infertility in men.
Now, we don't know how this is going to translate into humans. Again, this is now showing what is possible Zika can actually do in the testes. In theory, based upon animal models, what we need to know is how often and does this happen in humans? And the only way to do that is by longitudinal studies in humans.
He's hoping to one day have a solution. Diamond and a researcher at Vanderbilt University had a breakthrough, the discovery of a human antibody that may have the potential to protect people. In pregnant mouse models, the human antibody prevents the fetus from becoming infected with Zika and damaging the placenta.
We have a candidate antibody which is highly inhibitory, which can actually treat disease in animals, but it remains to be seen if it's going to be as effective in humans, and so we don't know that yet.
This could lead to the creation of a drug therapy given before a possible infection or during infection. The hope is to protect pregnant women, fetuses, and men.
Could be, yes. In fact, we're testing now. We haven't published that, but the next logical step was, okay, we understand that these antibodies could protect against in utero transmission. Do they protect against damage to the testes? And in the preliminary data that we have, we are seeing promising results, but we need to go further out to find out how late in time can we administer an antibody to reverse the damage to the testes. So that is a good question, and one that we're studying right now.
In this fight to protect the unborn from Zika, Diamond says there's still so much to learn, and the clock is ticking. For Innovations, I'm Kathleen Berger.